Hello, everyone. It's Thursday, April the 28th. Before I get into all the different stuff, that we go through, all the time on our COVID briefings, I want you to look at this. And there's probably thousands of names here and everything, but all these people were kind enough to wish me happy birthday. I mean, I can't tell you how much I appreciate and love all of you, and really, I got a big kick out of the fact, they've got happy birthday greetings with baby dog, but then a lot of people show their own dogs and everything, and I just think it's neat stuff, I can't tell you how much our companions bring, how much joy they bring to our lives and everything. The First Lady in communities and schools is doing stuff with therapy dogs at schools, that'll really, really help our kids. But I especially thank all those that were kind enough to write in and wish me happy birthday. I'm sure they've got a lot more important things that they need to be taken care of rather than that. But I do appreciate it, and thank you so much. We lost an additional 31 people since the last time we were here, since Monday. Some of these could be cleanups that we didn't get over the weekend, but now we're up to 6,855 deaths. I ask for your prayers always in every way, and I know that you're giving those because, I feel it. All these families, I'm sure some way, somehow will feel it as well, and I ask you, if you know them in any way, just please reach out to them. The 6,825th death in West Virginia is an 88-year-old male from Kanawha County. The 6,826th death is an 87-year-old female from Tyler County. The 6,827th death, a 58-year-old female from Jefferson County. The 6,828th death, an 89-year-old female from Randolph County. The 6,829th death, a 73-year-old female from Wayne County. The 6,830th death, a 63-year-old male from Cabell County. The 6,831st death, an 84-year-old female from Putnam County. The 6,832nd death, a 74-year-old female from Harrison County. The 6,833rd death is a 56-year-old female from Raleigh County. The 6,834th death is a 94-year-old male from McDowell County. The 6,835th death is a 64-year-old female from Wood County. The 6,836th death is a 69-year-old female from Logan County. The 6,837th death is a 75-year-old male from Pocahontas County. The 6,838th death is a 95-year-old female from Fayette County. The 6,839th death is a 74-year-old female from Raleigh County. The 6,840th death is an 86-year-old male from Tucker County. The 6,841st death is a 76-year-old female from Logan County. The 6,842nd death is a 79-year-old female from Lewis County. I want you to pay particular attention to these two. The 6,843rd death is a 42-year-old female from Putnam County. And the 6,844th death is a 47-year-old male from Cabell County. The reason I bring that up now, for days and days, every death that we've read is over the age of 50. These two are in their 40s, and they're the only two today that I'm reading that are in their 40s, and then we don't have anyone any younger. It tells us over and over that if you can get that booster shot or that fourth shot and everything, your second booster shot, and you're 50 and older, you really need to be doing that bad right now. The 6,845th death is a 67-year-old female from Fayette County. The 6,846th death is an 80-year-old male from Wyoming County. The 6,847th death is a 75-year-old female from Ohio County. The 6,848th death is a 90-year-old male from Preston County. The 6,849th death is an 81-year-old male from Jackson County. The 6,850th death is an 80-year-old female from Berkeley County. The 6,851st death is a 70-year-old female from Fayette County. The 6,852nd death is an 85-year-old male from Kanawha County. The 6,853rd death is a 91-year-old female from Kanawha County. The 6,854th death is a 72-year-old female from Nicholas County. The 6,855th death in West Virginia is an 86-year-old female from Kanawha County. 21 of these 31 were reconciliations. It doesn't really matter much. You know, we've still lost these great folks and an awful lot of precious wisdom, you know, that families, you know, are going without. And so please keep them in your prayers. With 799 active cases and 275 new positive cases today in the last 24 hours, our daily positivity rate's at 3.28. Our cumulative rate is at 8.11. We've recovered cases a little north of 493,000. We're still under 100 hospitalized, 94, 23 in the ICU units and 15 on ventilators. We're increasing counties that are in the yellow. We are up to 6 counties in the yellow, 49 counties in the green. Still good, but we really liked it when it was all green. Moderna said on Thursday that it has asked the Food and Drug Administration to authorize its COVID-19 vaccine for children under 6 of age, making it the first manufacturer to do so. Parents of roughly 18 million of our youngest Americans, the only population group not yet eligible for vaccination, have been waiting for months for pediatric doses. You know, hopefully it is here. You know, we don't have approval, but they have asked for approval. Right now, children ages 5 and older can be vaccinated in the U.S. using Pfizer vaccines. But nevertheless, you know, we're very hopeful that this will fly through and get approval. I've already mentioned our booster shots and how important they are, and it could not possibly be magnified anymore if you'll just look at the numbers. Just look at the numbers and it'll absolutely take you there. You know, from the standpoint of our vaccine distribution update, our numbers are still slowly getting better. We're now up to 90.7%, you know, the 65 and olders that have received at least one shot. And all the way across the board, it's the same thing. You know, we're getting just little by little better. The new vaccine calculator is all up, and you know, Dr. Marsh, I'm sure, can talk to you about that, but it's just another method to be able to take advantage of, that we ask you to do that it will remind you of when your shots are due, and it'll be able to better protect you. Again, I go over and over how important it is to get that booster shot if you're age 50 and above. You know, the additional booster absolutely will give you added protection, and it's safe, and we need you to be able to be getting that. You know, all the information on the COVID-19 vaccine info line is up on my website. All the free testing is up. You just need to take advantage of. You know, today we have 24 outbreaks in our long-term care facilities, none in our church community. We have 5 inmates and 3 staff cases in corrections. The rental assistance program is still available for you. You know, all you got to do is call us and see if we can get you qualified, and we'll try every way in the world to get you qualified within the rules and the guidelines. You know, also the homeowner assistance program is available as well, and you know, and in both cases it's a lot of money and everything. So if you'll call us, we'll try every way on this planet to get you qualified. You know, I remind you about giving blood over and over and over. You know, I've told you about the success of our Jump Start program, and like I said, we are really excited about that. You know, we're getting people back that we just probably never thought they would ever be back in the workforce and everything, and they're finding a real sense of pride and a feeling of accomplishment, and so we're very proud to be able to have incentivized them just a little bit to push them across the finish line to get them back into the workforce, because our small businesses especially really need them. You know, on Friday, I called a special session in the West Virginia legislature. They wrapped it up on Tuesday, and I want to thank them for considering and passing many important pieces of legislation. They've done a good job. We're proud of them. I guess it was, the days are running together, but maybe day before yesterday, on Tuesday, we went to an announcement of PepsiCo. PepsiCo, you know, one of our Fortune probably 50 companies that's in this country. They have continued to expand their operations in West Virginia. Absolutely, this is right outside of the town of Ona, and this facility is just opened. It's a $16.5 million facility, 100,000 square feet. It will employ between 75 and 80 folks. It is a tremendous distribution center and everything. And you see us there, you know, absolutely putting the hammer to that great, beautiful blue ribbon and everything. We've got our Speaker of the House and our Senate President right with us and everything. And the breaking of that ribbon was an important day. And you see the colors of PepsiCo there, and these people have got their act together, and they're doing a really wonderful job. In addition to that, you know, there's also another facility that they're working on that's going to be available, you know, within the same area, you know, within just not very long at all. And it's a $16 million facility. And so with that, they're going to be able to service a lot of folks in the area as well as the surrounding states. And for us to be able to land them here, you know, is a good day. A lot of the folks from Marshall were out there. The head football coach, head basketball coach, cheerleaders, dance team. A great day, just a really great day. Marco was there. He's all good, just good stuff. And so we're just really happy to have them. And you know, we're having a hard time keeping up, to tell you the honest truth, because with what's going on in West Virginia, they just keep calling and they just keep coming, and that's what we want to do. We just want to absolutely just have them keep coming and coming and coming, because they see exactly what I have told you about over and over. They see the rocket ship ride. They see that we're the diamond in the rough that people have missed. They see how valuable West Virginia can be to their businesses and their community and everything. And so it's good stuff, really good stuff. Last thing I've got is the announcement of some turnpike upgrades. You know, our West Virginia Parkways Authority awarded a contract for $24.8 million to technology company TransCore for critical upgrades to the toll collection system on the West Virginia Turnpike. And this is the biggest project they've had like this on the West Virginia Turnpike in 20 years. And the reason for it is just the amazing success of the Easy Pass program and everything. I think to get an Easy Pass now, it costs you, I don't know, $26 or $26.25. It gives you unlimited access to the turnpike. You know, it is a real bargain and everything. But with all of that, what those monies do is they just go right in to help us finance the upgrades and improvements to the turnpike from Charleston to Bluefield. And so it's awful good stuff. And we congratulate the Parkways Authority and Jeff Miller and all those great folks that are doing a heck of a job. We're really proud of them. And so let's just keep it going, keep it rolling. I love it. That's all I got.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
The first thing I'd like to do on behalf of our leadership team is wish you, Governor, a happy birthday. Even though we're a day late, we very much appreciate and value your leadership and your friendship. So happy birthday, and I love that many other West Virginians felt the same. So as we look at where we are with COVID-19, I think the news is overall still good. We know that, however, we are seeing a small uptick in the number of cases. We have seen a very small uptick in the number of hospitalizations. And as the governor reads every day for the beginning part of his remarks, we have lost more West Virginians with COVID-19. What's really important is that there is emerging data to really reinforce the impact of the most recent wave that we've had, the wave that was caused by the Omicron variant of COVID-19. In the United States in December, about 34% of Americans 60 years old or so were positive in the American Red Cross's assessment for antibodies, for evidence of immunity to COVID-19. It's been redone in the last week or so, and now 60% of Americans over 50, 60 years old are positive for antibodies with COVID-19, and 75% of our children are. So it really demonstrates the impact of the Omicron variant, and we talked a lot about how incredibly infectious it is. And as we look forward, we do notice that the number of BA2 cases are growing in West Virginia, and that we can anticipate that, as we see the variants grow, then we will likely see some episodes of increasing and decreasing the number of cases. And we need to continue to watch hospitalizations and death very closely. Because as we look at South Africa, which is where the Omicron variant first showed up and was reported, they are now having a lot of problems. And there are even more variants of Omicron. And South Africa is really seeing problems with the BA4 and the BA5 variants of Omicron. These are so new that we haven't got complete genotyping of them, so we don't know exactly where all the mutations are. But the presumption is that these variants are able to evade the immune system better than previous variants of Omicron. And in South Africa, they are indeed seeing an increase in the number of hospitalizations and deaths as well. So it just tells us that we need to continue to be very vigilant and keep our eye on our mission that the governor has given us, which is to continue to focus on saving lives and improving and maintaining the well-being of our state citizens, as well as make sure that we are maintaining hospital accessibility and capacity. The last thing I want to remind people that we know that the boosters are so important and making sure that you are current with your booster. And that's the reason why the vaccine calculator that is available from the DHHR website and also Vaccinate.ww.gov, which will allow you to put in your information to know where you stand related to your own vaccination. And we know from our own data that 75% of our deaths are in West Virginians over 50, but nationally, it's even higher. And it's really recently been found that nationally, if you look over 50-year-old Americans, the 920,000 out of the 991,000 people that have died thus far in the US from COVID-19 have been over 50, which translates to say that 1 out of every 125 Americans over 50 has died of COVID-19. And we know the way to reduce and protect yourself, not only from getting infected, but importantly, from being severely infected, going to the hospital, going to the ICU, or dying, is to get vaccinated and to be current with your vaccinations. Thank you very much.
All right, thank you, Dr. Marsh. Next, we'll hear from Secretary Bill Crouch with the DHHR.
Hello, everyone. The only thing I have is to echo what Clay said. Happy birthday, Governor. Didn't sound like you got much downtime yesterday, so hopefully this weekend you get to spend a little time with the First Lady and baby dog and your family and those grandkids. So I appreciate your leadership very much. Thank you, Governor. Happy birthday.
Bill.
All right, thank you, Bill. Next to Dr. Ayn Amjad, our State Health Officer.
Good morning. Governor, I also want to wish you a happy birthday, and I hope you had some fun yesterday and got to eat some cake. The only thing I was going to add to what Clay mentioned was, because we do get this question a lot, for the BA2 variant, to date, we have 80 cases in the state, but as he mentioned, we expect them to rise, so please go out and get your booster shots. Thanks.
All right, thank you, Dr. Thank you, Dr. Amjad. Retired Major General Jim Hoyer, the director of our Joint Interagency Task Force, had a prior engagement today. He will rejoin us next week. We'll now go to questions from members of the media. The first today from Charles Young with WV News.
Hi, this is Charles Young with WV News. Dr. Marsh, could you talk a little bit about the level of demand you expect to see when the vaccine for children under 6, is authorized? We've less than 20% of children ages 5 to 11 have gotten vaccinated. So I wonder if you think that we'll see a similar low demand among this younger age group, or if there's going to be a difference among the split there. Thank you.
Dr. Marsh, please.
Thank you, Governor, and thank you, Charles. Charles, it's hard to predict exactly what the uptake will be. We do know that for many parents who have young children who have not been eligible to be vaccinated, they are waiting with bated breath to have that moment that they can vaccinate their children and protect them. And we know that although children generally have done better related to deaths and hospitalizations than adults, we know that the multi-system inflammatory syndrome in children, the MIS-C, is really focused on children, and long COVID problems can also be focused on children, as well as children are an important transmitting factor group that can infect people that are vulnerable, immunocompromised, or elders. So getting children vaccinated is very important. But as you've pointed out, Charles, we have seen less uptake in our younger part of our populations eligible today. And this will be the youngest part of our population. So I hope that the uptake continues to be better than we've seen thus far in younger people. And we hope that parents really do see this as an opportunity to protect their children from these complications of COVID-19, but particularly also making sure that these children don't infect other people, because being vaccinated gives them the best chance of also being more resistant to catching COVID-19. Thank you.
All right, thank you, Charles. Next, we'll go to Paul Mullen with WCBC.
Morning, Governor. Good morning, everyone. Happy birthday, Governor. I'd sing except people would leave, and I would dance except people get hurt when that happens. Anyhow, I had a question for Dr. Amjad about the current treatment for COVID-19. We went through a period where they cut back on the monoclonal antibodies as a recommendation. I wanted to know is there a difference if you have been vaccinated, the progression of the treatment? Is there, and I'm sorry about that page in there. Is there a difference between whether you're vaccinated or not, the way you progress with your treatment from that point? Do they make that ascertainment, or do you just go into a general protocol? I'm wondering. Thank you.
Amjad, why don't you try this, please?
Okay. Yes, Governor. Paul, there is, if someone's been vaccinated and they get COVID, we don't necessarily pick a different treatment, as you're mentioning. So we still have monoclonal antibodies available, but we're also diverting a lot to the oral treatments, Paxlovid or molnupiravir. So to answer you simply, we want people, if they test positive, even if they're not considered high risk anymore, to go ahead and speak with their doctor about getting Paxlovid. It is available in the state in large quantities, so that can prevent you from becoming more sick, going to the hospital. But it's not, if there's someone who's probably never been vaccinated, we prefer the monoclonal antibodies, but access to that may be limited. So sometimes we do try to get Paxlovid to them as quickly as possible within that time frame. But that would be how we look at patients in allocating those medicines.
All right, thank you, Paul. Governor, I'll turn it back to you.
Well, first of all, again, thanks to all the people, that, gave me the well wishes on my birthday. They were probably surprised I made it this long, but nevertheless, I really do appreciate all the kind words. I only have one point. And this, again, every day, I write down, what our experts are saying. I try to listen, I try to learn, and I think that's how you get better. We all know that. But Dr. Marsh just said something that is so profound. You know, there's a lot of people, without any question, in the United States of America. And Dr. Marsh, I think, just said that 1 out of every 125 people in the United States of America has now died, that is over the age of 50, has now died from COVID-19. 1 out of every 125 people in this great country that are older or that are 50 years of age and older have perished from this terrible, terrible, dreaded killer. Now, if you put it in those words, surely to God above, if you're 50 and older, that's got to get your attention. 1 out of every 125 have died in this great, great nation. Absolutely, you do not want to be a statistic. You can be a statistic. That's all there is to it, over and over and over. And this lottery is not, 1 out of a million. This is 1 out of every 125 people. Now, with all that being said, how can you be assured, almost 100% that you're not going to end up on that list, and that's get your booster shot? So I remind everybody over and over to just go do that. Absolutely, with all in you and everything, it'll be the very best thing that you've done, and today is the day. Today is your day to do that. So don't wait. Please don't wait. Don't let it be too late and everything. But again, I thank everybody. I thank all the well wishes. I thank everybody for all the hard work that they've put in. And my team has been unbelievable. You've been really, really good, and you know that. And I absolutely thank you from the bottom of my heart. So God bless everybody. Thank you all so much.